A talented footballer who had ambitions to compete in the Paralympics. 18-year-old Oliver McGowan was a much-loved son.
If there was ever a negative, he would turn it into a positive. He had such a witty, dry sense of humour, very spot on with his humour. I don't know how he did it, but for some reason, people were drawn to him.
Oliver had mild autism, cerebral palsy and epilepsy. He was admitted to Southmead Hospital in October 2016, suffering life-threatening seizures and extreme agitation. Doctors put Oliver into an induced coma. In order to control his agitation once he was woken up, Oliver was also given an anti-psychotic medicine called olanzapine. But Oliver had already had this drug the previous year at Bristol Children's Hospital, and his parents say he reacted badly to it on that occasion.
Started hallucinating, which he'd never done before. He was jumping on tables, ripping his clothes off, saying he wants to pull his teeth out. It was unrecognisable, to be fair. The change was just like a switch.
Months later, Oliver was readmitted to Bristol Children's Hospital and given another anti-psychotic called haloperidol, which forced his eyes upwards, a recognised reaction to the drug. Because of this history of severe reactions, Oliver's parents asked the Southmead doctors not to give him any anti-psychotics.
The doctor agreed and assured us that he would not use those drugs. In fact, he wrote it on the front of his prescription chart in the allergies box. Later that evening, when a nurse was giving Oliver some medication, and like we did, we said, "What's Oliver being given?" And the nurse told us, olanzapine, at which point we were shocked.
Oliver suffered a severe reaction to olanzapine, which was only fully revealed in a brain scan.
We were taken to a side room, and we will never forget the words used, where his brain is so badly swollen it's coming out the base of his skull.
Paula and Tom were told their son's prognosis was appalling, and the family agreed with doctors that life support should be withdrawn. Today, a coroner found that Oliver's death was partly due to his reaction to olanzapine, but he said doctors had been right to prescribe it and couldn't have foreseen the effect it would have. The inquest heard that brain swelling like Oliver's occurred in only around 1% of patients on olanzapine, and that it's fatal in only a fraction of those cases. But Oliver's parents insist they should have been listened to. They say their son's previous reactions to antipsychotics, although different, were reason enough not to give him them again.
We sadly still consider that the doctors who treated him were arrogant and dismissive of Oliver's particular needs, and we are therefore distressed and concerned that the coroner has made no recommendations to avoid future deaths.
Recording a narrative conclusion, the coroner said the Southmead doctors had followed accepted practice in prescribing olanzapine and that their management of Oliver had been entirely appropriate.